It's been a while and I'm back here again at my favorite place at the CSA Medical Aesthetics. And sa mga hindi po nakakaalam sa akin, I'm Ma'am Weng Laughlin, your Provincial Director of Mutianong Pilipinas, Pampanga. Lahat po na nagtatanong sa akin, what did I do? Bakit daw I look 20 years younger? And this is the secret talaga. Yun pong ginawang procedure sa akin, yung facelifting. It's a non-invasive procedure and instant effect talaga. And as you can see now, talagang bumata daw po ang hitsura ko. And thanks to CSA, of course. As you notice naman, very thin po kasi yung lips ko. And marami nga nagsasabi na isa sa mga nakakatanda sa face ng babae yung pagkapag thin lips ka. So parang i-volume ng konti in the doctora yung lips ko, and she will do lip filler. And don't forget to click and subscribe.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a returning guest,
Yes.
Ma'am Weng Laughlin.
As always.
Welcome back.
Hello.
She looks a lot prettier and younger. 8 weeks ago, we have done a procedure on Ma'am Weng. It was like a workshop amongst doctors whereby we trained other aesthetic doctors. So for Ma'am Weng, we already did a non-surgical nose enhancement using the Wyco PDO threads. And then we also did the forehead projection using a combination hyaluronic dermal filler plus the spiral cog PDO threads to project the forehead and also lift the eyebrow. And we did a mid-face lifting using the scaffold threads and an end-fixed thread lift on the posterior aspect of the face. Plus, we were able to do some lifting on the upper neck. How was it, Ma'am Weng?
Yun na ang sagot. You
Right.
got it.
Correct.
Kasi Doc, ang dami nagtatanong.
Yeah.
And it's overwhelming talaga kasi lahat ng makakita sa akin ngayon, whether yung dati na ako nakikita at madalang nilang makita, there was a big change on me.
Correct. Yeah.
Which is, I look, yun na nga,
Younger.
20 years younger pa nga ang sinasabi sa akin eh. And that's the answer po. Si Doc
Yes.
ang sumagot.
So the effect was natural.
Natural.
Okay. And this was a non-surgical technique, like a total facelift via non-surgical method using our PDO threads. And these PDO threads are absorbable types of threads. They are clinically proven safe for our face structures. Plus, they're already regenerative materials, meaning to say they stimulate collagen formation and also strengthen the tissues and do a lifting of the saggy tissues in our face. Kaya po si Ma'am Weng ngayon, she's 10 years younger. Okay?
20.
Okay, 20. Okay, she said 20 years younger. A lot of people notice
Yes,
the
I really
improvement,
love it. Yes po.
the change. And the wonderful thing about it is that it is within the ratios and proportions. We follow the rules of ratio, proportions, symmetry, just the right dimensions for a natural effect. And also, like over time, you're further seeing improvements because your PDO threads will stimulate those collagen synthesis, elastin synthesis, okay? And for today, this is a follow-up of what we've done 8 weeks ago because we haven't yet really completed it working on the mid-face section, the center vertical fifth. So we have like horizontal thirds of the face. We also have the vertical fifths of the face. So we wanted to work now on the center vertical fifth. Starting on this glabella area, she already had a lifting here with that spiral cog thread plus also the hyaluronic substance. We wanted to relax her glabellar muscles, right, Ma'am Weng?
Yes.
And then her nose already had that good augmentation. I still wanted to narrow the alar width. So we want it within the intercanthal width. And a little bit of a boosting, just a booster of the bridge augmentation. And then looking at the lip section, this is the one that I really want to work on. We lack the volume on the lips and the contour on the lips, okay? As we age, we lose volume in our lips, we lose the contour in our lips. There's a so-called inversion also, plus others are noticing perioral lines or wrinkles around the lips, and also the downturning of the corner of the mouth or the oral commissure. So we want to treat that. Plus this nasolabial and a marionette. So those are the things that we want to improve for Ma'am Weng today as a follow-up of what we've done 8 weeks ago. We'll show you when CSA Medical Aesthetics return. And we're back. So we're working on the center vertical fifth of the face of Ma'am Weng. So we say that this is the key attraction point of our face. Actually, the nose, okay, and the lips. And we could already include the eye area, the cheeks, and the chin, as well as the forehead, okay, attraction key points. Now, since we're working on the center of the face here, the vertical fifth here, we have to be very careful with anatomical structures. So specifically here, okay, we have on the, for example, the facial artery comes out from your mandibular notch here and it goes upward there to the sides of your nose. So we have facial artery branching out corner of the mouth into your superior and inferior labial arteries. Then as it goes upward to the nose, there will be an inferior alar artery, also the lateral nasal artery, and the terminal branch, the angular artery. Then the angular artery may anastomose to vessels here in the upper third of the face. So we have supraorbital supratrochlear here. And there's also a branch here we call dorsal nasal artery. And be careful also with the so-called intercanthal vein in the radix of the nose. So make sure we know anatomy, we know the vascular supply. Plus anatomical tissue layers of the face. We have to be very familiar with the 5 tissue layers: skin, the superficial fat, the mass and fibromuscular layer, the deep fat and the retaining ligament, and then the space, plus the periosteum, or on the nose, both periosteum and perichondrium, okay? Now, I'll start working on the nasolabial fold here because I noticed a while ago that Ma'am Weng still has this deep nasolabial fold and actually still a marionette line here. So we want to improve that. Now, I need to restore volume on this piriform fossa. As we age, the maxilla resorbs. So there's gonna be a deepening of this piriform fossa here. So we wanna restore the volume there. We can make use of our hyaluronic filler with the high G prime or high molecular weight. Now just direct it into this piriform fossa here. So Ma'am Weng had lidocaine cream a while ago. We numbed the skin with topical lidocaine cream and we left it for about an hour. Now I still, in my practice, I do an aspiration, okay? I know the facial artery can pass through this nasolabial. It could be medial, it could be lateral, or it could cross lateral to medial, medial to lateral. I'm onto the bone, the piriform fossa here. It's so deep, so just aspirate. And then, once there's negative aspiration, we can push the product. So the thing here is make sure you're in the right anatomical plane, okay? So it's a matter of knowing your anatomy, the right tissue layer. So I wanted to lift this part here. I'll just use a 0.3 mil and then I'll go to the opposite side. Okay, disinfect please. Using the same technique. And this one has a lidocaine with it, so it will numb the tissues inside already. So it's really deep. Feel for the bone. And then place again your, like a 0.3 mil of your hyaluronic high G prime here. So we need a substance that has good rheology, good clinical property, and also good clinical behavior. We love that technique also, the filling in of the piriform fossa for patients with wide nose or wide alars. Once you fill this in, there will be an effect of narrowing also the alars. Okay? So let me proceed with the nasal tip projection and a booster of the bridge area. I'll just numb my entry point. Okay, this is the entry point. You can have an entry point at the so-called tip defining point here. So this is just a lidocaine, Ma'am Weng. I know the lidocaine has like a stinging sensation. Then I'll use a gauge 18 or gauge 19 needle, sharp needle, to make an entry point there. Okay. Now, I want to numb the entire dorsum of the nose. I have a lidocaine with epinephrine here. Okay. And I use a gauge 22 cannula, a long one. This is like around 50 millimeter length. Okay. I'll glide it in the tissue space. This is just to numb the inside tissues of our nose. Okay. So this is like a lidocaine only. I'll squeeze the nose like this. Pinch rather. So pinch the nose like this. Like a pinching effect. Now we want to stay in the supraperichondrial, supraperiosteal layer. That is the right anatomical plane. And I want to infuse this lidocaine. Just a small amount of the lidocaine just to numb the area. You're still good, Ma'am Weng?
Yes.
Okay. So Ma'am Weng already had an experience with non-surgical thread lift. She knows what to expect already. So I need to reach that so-called radix part, the nasion, or even at the inferior part of the glabella to numb the area. So this is just a lidocaine, like a 0.5 of this one I can push into this area. Then I want to also numb the columella area, the intercrural space here between those cartilages in this columella. Like push a little bit of my lidocaine there. Okay, just a little bit. Pinching the nose, Ma'am Weng, pulling it up. And I want to reach the anterior nasal spine, just a lidocaine. It's normal for you to feel also numbness in the upper gum area. And that will help us in doing your lips. It's already gonna be numb. Okay, so I'll start with doing the booster for my bridge area. So she had 5 Wycolong already, and I'll use additional of 3 Wycolong because Ma'am Weng doesn't really want that very high nose.
Yes.
So she wants just a natural
look.
Yes, just an enhanced,
Subtle.
only. Okay, this is one. Okay, pinching up to the radix and pulling out, and a second one, pinching and insert, and then pull out, and then third, pinching, and then up to the radix there. Make sure that you have a parallel left and right dorsal line. So we're done with the bridge. Now let's do the tip columella. Now the same entry point can be used for inserting into your columellar space. Okay, there are cases that I use a second entry point if they have a short columella. So if you have a 40 millimeter length thread here, just estimate, like this could be like 30 millimeters. So if I have a 40 millimeter length, I can make a second entry point. So again, this is a case-to-case basis. Okay, I can still add a bit of my filler in that anterior nasal spine, just like the one I used in the piriform fossa, and insert it into the intercrural space there onto the anterior nasal spine. You have to reach the so-called ANS in this area, the bony area, just to project the tip region. Now let's use our Wyco short, because last time she used like 3 pieces here, so we can add 1 and then a last one. So it's just gonna be perpendicular onto the anterior nasal spine. Okay, so we're done with our nose booster. So this is just a bit of a pressure here. So let's now proceed to the lip area. So we want to restore the volume of our lips and also restore that contour of the lips. Okay, I'll just do a so-called cannula method. Okay, I'll make an entry point at the corner of our mouth here. Okay, this part here and twist the entry point. So I have a cannula here, a gauge 25 cannula, and I'll use a hyaluronic filler for the lip. Okay. So we wanted to restore volume here, then I'll also push it, glide it in the so-called subdermal plane. The labial artery in the lip area is on the mucosa, inner part, oral mucosa part. So we want to avoid that part there. So we want to go as much as possible in a superficial plane. So I'll make a first line here of my product. Then I'll go into the vermilion body, the red lip area. So we have different techniques in doing the lip enhancement, okay? You can do your lollipop technique. There's also a so-called Russian technique. There's even like if you want to get a cherry lip, we can do that. Or those emphasizing the tubercle of the lips, we can also do that. So I'll make a like a fanning, I'm doing a fanning technique here. Then I'll now go to the lower lip. Actually, we've done already the first session for Ma'am Weng on the lip enhancement last time. But that is more, just a little bit, because she wants gradual change. She doesn't want to like an abrupt, drastic alteration of her face. We only want subtle, simple, and subtle. So now I'll proceed to the lower lip, okay? So expected to have a bit of some resistance here because Ma'am Weng actually has a marionette fold, a deep marionette line. So some of the tissues are kind of like in this area, you know, as we age, there are like what we call fibrosis that had developed. And we'll just proceed to this lower lip area here since we are in the corner. So doing the cannula method for the lip, it's an advanced method actually. Whenever we train doctors, we start with the so-called needle method, okay? So the cannula is an advanced one. So let me just push a little bit because this is so sunken, really like it lacks volume on this corner here. We can improve a little bit the area here because there's no much of a volume. So let's just infuse a little bit. Plus, we have given a nerve block, infraorbital nerve block a while ago and a mentalis nerve block a while ago. So I already am in the lower lip vermilion border there. So I'm just gonna infuse my product into the body. As to the amount, it will depend on the need plus the desire of your patient. Some patients just want subtle. Like for every part, like for example, you do the upper lip, you can have like a 0.25 on the right side of the upper lip, 0.25 on the left side. Same thing on the lower lip. On the right lower lip, 0.25. On the left lower lip, you can add 0.25. So just minimal amount, subtle only. Right now, we have a saying in aesthetics, less is more. So we also want to avoid the so-called overfilled syndrome. I'm just going into the third line for the vermilion body. Okay. Just a little bit more here. So actually, Ma'am Weng needs volume on her lip because actually our lips get dehydrated also. So we want to restore that so-called water holding capacity of our lips. Hyaluronic is known for being hydrophilic. It attracts water. It restores dehydration of the tissues and it volumizes. Okay, now I'll finish off with just placing threads on the nasolabial here and the marionette. Then I'll do the other half in a fast pace. Okay, let me just put on a so-called mesh kind of a PDO thread here. So we have here a mesh type, multi-filament type of PDO threads, which I will just insert on this nasolabial area here in a so-called subcutaneous plane, okay, just to improve the so-called marionette fold. Okay, and then press on it and pull out. Then you can have a second one there. Then actually you can even add filler for this one. We did filler in the piriform fossa a while ago. Then there you go. Actually, the right line is deeper than the left. So we can probably add also another for the so-called marionette fold. I'll just do a twist on this one because some of the threads are still coming out. We need to bring it back again and make sure that all the thread strands are inside this nasolabial tissue. Okay, and finally we can just give, it's either like you can add a low molecular weight type of a filler for this one, or even like a PDO thread. Let me just use the same one, entry point. So entry point should be at the lower border of your marionette fold here, like a tiny prick, and one multi-filament or braided type of thread will be enough for this to stimulate collagenesis, restore support, strengthen this area. Okay, so we finish off with our right side. Let's do the opposite. So we have done the left side. We'll show the result to Ma'am Weng when CSA Medical Aesthetics return. And we're back. So let's show the result to Ma'am Weng. Ma'am Weng,
Yes.
here's the mirror. Okay.
Oh my God.
So we've done combination procedures for Ma'am Weng. That is to really
look at that.
complete the rejuvenation procedure for her. So we did the booster of the nose. We also did lip enhancement, restoring volume and the contour. Plus also like working on the nasolabial and the marionette. And actually, I'll still add up the glabellar injection of your botulinum toxin to relax her muscles here on the glabella, the procerus, and the corrugators, to really smoothen the skin on the glabella area because she has a strong glabellar complex. How was it, Ma'am Weng? Yeah.
Oh, what can
Still
I
you.
say?
Still Ma'am Weng, right?
Yeah,
The enhanced
Still me naman, Doc.
Ma'am
Yes.
Weng.
This is what I want. Yung
Yeah.
subtle lang. Subtle
Right,
but
yeah.
strong. Diba?
Right. And I
So,
noticed the shape of your lips. It became a bit heart-shaped.
Yes.
So we were able to
I
also
like
give
it.
that kind of like tubercle in the lips because we have this natural lip tubercles on the lower, like 2 on the laterals, and then on the upper, like we have 3 tubercles on the upper. So those are injection points also that you can do for your patients to give them that restored volume plus contoured lips plus like a cherry-like lips, something like that.
Yes,
More of
wow.
a young version of them. And like, of course, it makes them feel so confident about themselves, you
True.
know. And the thing is, with aging, we lose all those connective tissue, fibrous matrix proteins because of the degradation of this like collagen and elastin, and less of the production or synthesis of this fibrous materials in our tissues, in our skin. So right now, Ma'am Weng has this. There you go.
Yes, I
The
have this.
outcome of our non-surgical treatment for a full rejuvenation of her face, okay? So we did complete your, like the center of the face, the center vertical fifth of the face, working on the nose, the lips, nasolabial, marionette, okay? She has a good chin already. It's a good chin projection. It's within the Ricketts E line. So it's fine. In terms of the length, it is also okay. So we just follow ratios and proportions. Any message, Ma'am Weng, or anything you want to share to the audience?
Yes, now, you know, tayong mga babae, Doc, usually, may
Yeah.
kasabihan nga the self-confidence, you know,
Right.
it's the best thing you can wear for free.
For free.
For free, di ba?
Right.
And if there's something you can do for yourself, why not?
Correct.
Okay,
Yeah.
and if you want to do it, of course, just do it with a trusted skin
Thank
and
you.
medical aesthetics. And only here at CSA with Dr. Contessa Alapag, Salvador
So,
Alapag.
correct.
Okay.
Should only be performed by those authorized practitioners, injectors, okay? And this one requires like training. The training is not a short training, okay? It takes a long time to learn all of this, master all of this, okay? And it's not just head knowledge, but there should be like the skills, the hand of the doctor or the injector, and also there's this clinical eye for beauty, an aesthetic eye. Dapat package lahat yun. So again, we warn you that these kinds of procedures, these are also risky in the hands of untrained, unauthorized performers or injectors of these kinds of procedures.
And if I can add, Doc, marami ding nagtatanong kasi kung how, nakita niyo po, it's less than 1 hour procedure with the nose lift and the lip filler.
Actually.
It's just less than 1 hour procedure.
Correct.
People are asking, can they go back to work after? Is there any downtime?
So every after treatment, we give you a list of do's and don'ts, okay?
Yes.
So like there are like things you have to avoid, okay? Definitely avoid strenuous activities after doing this procedure.
Yes.
If you can rest a day or two, if it's a multiple kind of injection procedures. But if it's like a single treatment only, the others go back to the work, to their work. Sometimes we call it a lunchtime treatment. Actually, when I did mine, a lot of injections, I still had to go to my clinic and see my patients, okay? And it's a case-to-case basis. Some people can like tolerate this, some people have low tolerance. So it will depend, okay? Some people, like they go back to their work, okay? So thank you so much, Ma'am Weng.
And thank you so much, Doc.
Yeah. Any social media account they can follow you?
Yes, they can follow me through Mutia Pilipinas Pampanga page. So anyway, actually, we have an upcoming event for the Mutia ng Pilipinas Pampanga 2024 on June 15. Hopefully po, yun ang schedule na masusunod. So just check out our page.
Advance congratulations on that. Okay, if you have any questions, you may email us at csaskinclinic@yahoo.com. Our FB page is CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact numbers 0933-860-9193 or 0917-504-4268. And please do watch our other videos. Okay, you can check Ma'am Weng's old video and check how she looks like during that previous videos. And you can do your like comparison. Okay. Thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.